Okay, today let's think a little bit about acupuncture. We're always trying to pick the right points for the right diagnosis for each individual patient. But the problem I notice in TCM style acupuncture is that people end up getting caught in the trap of picking the same points again and again, right? And so, what we're going to think about today is some of the criteria by which we choose points, and we can try to broaden our perspective about the kinds of points we might pick for different kinds of issues. So let's think about sort of historically, right? So you have a book like Peter Deadman's book, so you might think about, well, what does this particular point do, and go look in there and read up on it and stuff. Historically, the way that this kind of worked was in the 70s, the kind of the first generation of American and European acupuncturists were beginning to go to school and to graduate from school. And the problem is that they weren't getting much of a training in traditional acupuncture styles. They were getting the basic herbal theory and then kind of being cut loose, right? So they're learning acupuncture points as if they're herbs. So here's a couple of things that this acupuncture point does, and then off you go. But then you kind of start thinking like, well, I know liver 3, but then what do I do outside of that? What about liver 2 or liver 4 or liver 5 or these kinds of points? Well, now we've started to broaden our perspective more and more, but then they didn't have the textbooks that we have. They didn't have the translations that we have. They didn't have access to as many of the teachers coming over from Asia to teach. So what a book like Peter Deadman's book is really, it's his attempt to apply some structure to acupuncture, right? So each point that he discusses, that's him sitting down and thinking about each particular point and what it does based on what it is. Right? Oh, this is the Hasi point, and this is the fire point, and therefore we know, and maybe based on its location. So these different kinds of things. In a more traditional acupuncture system, these may be laid out more clearly for the practitioner, but in a sort of herbalized acupuncture style that TCM is, it's a little bit tricky sometimes to know exactly why a different point does what it does, in the same way that it's not always easy to understand why an herb does what it does. Right? Is it the color of the herb? Is it the shape of the herb? Is it the shape of the plant? Is it how close to the ground it grows? It's all these different factors that we think about that say, okay, well, maybe this is why people thought it did this. But there will be many functions that an herb may have that are just simply difficult to drill down into to figure out exactly why that's going on. But in a sense, you're not too worried about that. You just read, you say, oh, Bai Shao does this, and so you use it, right? Well, the same goes for points. The problem being that it's not so easy always, again, to unpack exactly why a point does what it does. So then it becomes tricky if you want to pick a point for a very bespoke kind of reason, a very specific diagnosis. You want to be able to pick the right point for the right patient. So today, what I think we should do is we'll look at metal points, and we'll say, okay, what is it about metal points? Because there's a number of them, and we use them in a certain way, but we don't necessarily think about why that is. Right. So we spoke I think it was the first episode when we talked about qi stagnation of the chest, right? And we talked about liver 4. Right. So this is then the metal point on the wood channel. Okay. So then it made sense there. Just in a very general way, we're saying, look, in qi stagnation of the chest, we're talking about liver stagnation that has invaded into the upper jiao, is affecting the lungs, is affecting the heart. And then so by using the metal point, you're sort of creating that connection point between those two elements, right? So you're using a liver point that can regulate its relationship to the lungs, its relationship to the chest, right? So we're making that assumption. But then if you look in the TCM textbooks and what they say about liver 4, they say things that what you end up seeing a lot in the books when you look across various sources is they'll say a lot of things that talk about stagnation. So a lot of excess conditions is what we're using liver 4 for. I was talking about it in the first episode. We're talking about clearing heat from the chest by creating movement, right? And so this notion then of using liver 4 as a metal point to create movement. But we could actually get a little more specific about that. In some acupuncture traditions, actually the way that they use an elemental point, like a metal point, is to think about its herbal action. Meaning that we associate what? Acrid spiciness with the metal element, right? And so in the case of liver 4, where we're using it to regulate the chi, we're using the metal element to regulate the chi of a metal part of the body, essentially. But if you think in this way about it being spicy or acrid, then it has a more, we think of it as having a more, it imbues liver qualities with a more movement-oriented type of thought process. You know, you think of herbs like chaihu, which is acrid, or herbs like xiangfu, which is also acrid. And they both have this chi regulating quality where they move the chi. The thing you have to remember here is that the lungs, remember, are the engine pushing chi through the channels in the same way that the heart is the engine pushing blood through the vessels. So by activating this, in a sense, engine that is pushing chi through the channels, you're creating movement. You're creating regulation, right? So you're activating that quality of acridity, and especially when you're doing it with the liver channel, it relates to this overall movement of the chi in the body, because the liver regulates the chi, the lungs push the chi through the system, so you're kind of doubling up in a sense on regulating that chi, creating movement. So most of the time in TCM thinking, we use liver 3. We say, oh, liver 3, large intestine 4. And that's no problem. I don't mind that, because maybe you are, by using that kind of earth point, you're saying, look, the liver, I want to imbue the liver with as much strength to do what it's supposed to do, right? An earth point, building point, right? I want to imbue the liver with its strongest ability to do what it can do. Okay. Maybe that is the case. But if you have even more stagnation, then maybe liver 4 is the way to go. You know, you really have that wiry pulse, or maybe even a choppy pulse. We'll take some time, we'll talk about a choppy pulse. But if those are going on, it's really quite strong, then maybe sometimes liver 4 is more applicable than liver 3. Of course, palpation. So often I find I get into liver 4, it's quite tender, which is always telling me this is the point I need to use. More tender than liver 3. Okay. Another point that's similar to this, actually, and has a very sort of, in a sense, a similar function, is heart 4. Heart 4, when you look at how it's listed to be used, is, again, it's a lot of stagnation kinds of symptoms around the heart. For example, stuttering. So it's commonly listed for this point. It treats stuttering. And it's so often, like when I treat kids, what I see as stuttering is really this kind of liver situation where there's a liver stagnation and it's affecting the heart. Remember, the heart is the final arbiter of speech. All the organs come together to create sort of the shen, the mind, and then the heart delivers that speech outwards. Remember, the tongue is the flower of the heart, right? So it delivers that speech, and so it depends on the heart. So speech is such a clear window into the health and the nature of a person's shen. And so when I see stuttering, it always makes me think, there's some kind of emotional blockage here. This child can't express themselves, right? So I'm always thinking to myself, liver and heart. So in this case, do I use the wood point on the heart channel? That doesn't quite strike me as correct. More, I think, would be to use the metal point on the heart. I want to regulate the chi as it's affecting the heart. Heart 4, sudden loss of voice. This isn't like chronic loss of voice. This is sudden loss of voice. Well, sudden loss of voice outside of something like a wind heat or some kind of external attack, sudden loss of voice in this situation is, again, an emotional thing. So to have it be sudden, it certainly implies that wood is involved. It certainly implies that the liver is involved. They list things like chest pain, but especially with strong emotional states, which again speaks to me about this kind of stagnation. The sudden onset of chest pain related to a high emotional state, acute cardiac pain. These strike me as, even if they're not necessarily emotional, they strike me as related to qi stagnation, right? Pain, by definition, has stagnation involved. And so this kind of thing. So here, Heart 4, I like to activate that acridity, that spiciness, which creates movement, right? You're activating the lungs, in a sense. You're activating the lungs' job of being the engine of forcing qi through the channels. The lungs can push through stagnations, right? So it's a common thing. Oh, somebody is stressed out. I'm going to go for a walk. I'm going to go for a jog. And then when they're done with their jog, what do they say? Oh, I have more perspective on my situation, right? Well, in a sense, what you did was you went for a jog and you huffed and puffed and you breathed. And by activating the lungs, you blew through a stagnation. Metal, regulating wood, chopping that excess wood. So you activate the breath to blow through stagnations in the channels, blow through stagnations in the organs. However you like to think about this, this might be one sort of perspective to bring this to light. So then the heart, using the metal point on the heart because it's affecting the heart area, using the metal point on the liver because it's affecting areas associated with the liver. Like we mentioned the chest, right? But in liver 4, it's very common to use liver 4 for qi stagnation affecting the lower jiao. Now, I don't totally understand exactly why the lower jiao specifically, but it does, right? So testicular pain, hernial pain. Again, this sounds to me like stagnation. Now, we often say, oh, liver 5 is the point that we access, because remember, the liver channel wraps around the genitals, around the groin. Liver 5 is typically the point we use for this. And yes, this seems to be true, because very often that's the point that works. How do you differentiate? Palpation, 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 always. So if I have somebody coming in with some kind of groin pain, some kind of lower jiao pain that I associate with some kind of excess stagnation, first thing I'm going to do is palpate liver 4, palpate liver 5. Which one is more tender? Then I'm probably more likely to needle that one. But in this case, we're talking about liver 4. We talked last time in the second episode about regulating menstrual pain. Liver 4 is a perfectly good candidate for this. How does it regulate menstrual pain? Well, in this case, with liver 4, you're activating that acridity. It's like the xiang fu again, breaking through stagnation in a particular area of the body that we associate with the liver, right? So this then is one way to think about these points. The metal points are activating that spiciness, this acridity, to activate the lungs' ability to push through stagnation, as it applies to the liver and the areas associated with the liver, as it applies to the heart and the areas associated with the heart. Okay, so that's one way to think about this. Another way to think about this is for points like spleen 5, right? So spleen 5 is very commonly the point that we use for dampness and phlegm in the spleen, in the body generally. And then you're activating the spleen for dampness, to clear dampness, wherever it is. And spleen 5 is typically the most commonly used in a TCM sense for this purpose. Although I do notice among practitioners that this seems to be forgotten in a sense, but when you look through the literature, it's always listed as being used for dampness conditions, heaviness of the body, dampness conditions in the middle jiao, diarrhea, these kinds of things, over and above other spleen points. It calms Shen, but especially when the Shen issue is associated with phlegm, maybe phlegm misting the mind. You even see that this is very useful. Spleen 5 is very useful. It's commonly listed for spleen 5 that you would use it for speech issues, tongue stiffness, right? So in these cases, many, many speech issues, I see this, of course, in so many kids, speech issues so often being related to the presence of dampness, being related to the presence of spleen deficiency, which is underlying the ability of the body to build up this dampness and affect the tongue, make a stiff tongue, or make some issue where the tongue doesn't work correctly. You know where I see this a lot is in autism. And so these kids have, across the board, all autistic kids always have some amount of phlegm, sort of insubstantial phlegm misting the mind. And what's interesting here is what you find is that they have poor tongue dexterity. So you tell them to stick out their tongue, and often they can only stick it out a little bit. Or you tell them, try to touch your ear, bud, with your tongue, and they can only kind of move their tongue a little bit outside of their mouth. So their tongue dexterity is actually quite poor. And so is this tongue stiffness to some degree. And of course, it affects their speech, which is amazing because when you start treating autistic kids, what I find most commonly is the first thing that changes for them are changes in their speech. Over and above other behaviors, over and above anything else that's going on. For some reason, speech is the first thing to change. Well, so often when I'm treating them, I'm treating the spleen because I see autism through the lens of insubstantial phlegm, right? But then why a metal point here? This is not as much to regulate qi, I think. Remember that also acridity and spiciness is how we act, is the flavor in certain herbs for resolving dampened phlegm. You know, so you think about a herb like, very specifically to this example, like Shirchangpu. So I'm going to use Shirchangpu all the time in my autistic kids to clear that phlegm that's misting the mind. It has that drying quality, which we associate with this acridity, this spiciness. You look at herbs like muxiang and sha ren, right? So common herbs to use, like xiangsha lu junzitang, and they have this. Not only what's nice here is that it not only do they regulate qi, stagnation in the middle jiao, they also resolve damp to some degree, right? So to this point, it's quite interesting. You know, a lot of the times we talk about liver affecting spleen or wood overacting on the middle, you know, and so then we would think, oh, it's always Chaoyasan or some kind of Chaihu-based formula here. But actually, very often you actually might want to use something like Xiangsha Lu Junzitang, right? Because it's the spiciness of those two herbs which actually kind of regulates the qi of the abdomen. How can you differentiate here? I think pulse is a good differentiator here. If somebody is having emotional related digestive issues, if the pulse is wiry, then yeah, I think a Chaihu based formula is reasonable. But if the pulse is more weak, then it indicates that the spleen deficiency is the more significant factor here than the liver excess. In that case, the Xiangsha Lu Junzitang is useful, and it's sort of the Lu Junzitang portion of the formula strengthens the spleen. And then it's kind of the muxiang and the sha ren sort of almost regulate the qi of the middle jiao. Remember when we were talking about qi stagnation of the upper jiao, and we were saying hopo can regulate the qi of the upper jiao. Both of these herbs, the muxiang and the hopo, they don't regulate the liver per se. But it's the acridity or the spiciness of those herbs that regulates just the qi of their target area. So they kind of just help move the stagnant qi in that area, but the main focus is on supplementing the spleen. That's the treatment there. So this is so for spleen 5, then that's I think why spleen 5 is so commonly listed in the TCM textbooks as being used for heaviness of the body, dampness conditions of the middle jiao, and these kinds of things, and then also phlegm conditions, phlegm misting the mind conditions especially. So it's like any damp and phlegm condition affecting the middle jiao, any damp and phlegm condition affecting the head. But I still like to use this for damp conditions affecting the lungs, right? It's still the metal point. So if I suspect that phlegm is an aspect of a child's asthma, spleen 5 might be the choice. Remember, I mean, spleen 5, it still supplements the spleen, right? But it's just the focus of it, kind of the sort of what you exactly want the spleen to do. All these points supplement the spleen. 1, 2, 3, 4, 5, they all supplement the spleen, but each one has a slightly different function as it relates to what the spleen generally does. And so what you see in the textbooks here, spleen 5 for dampness, for phlegm. You see this with pericardium 5. In distinction to heart 4, for some reason, pericardium 5, you see it more listed for phlegm misting the mind conditions. So whereas heart 4 tends to be more listed for stagnation issues affecting the heart, affecting the Shen, affecting the chest generally, for some reason, pericardium 5 is more used for phlegm misting. I'm not sure what the difference is here. If anyone knows, I would be happy to be enlightened by such knowledge. But this is what it is. So that's why so often in autism, I'm pairing up pericardium 5 with spleen 5. It just almost always, so this is kind of the thing. So again, here it's different. It's somewhat to do with regulating the qi, but as it's a lot, what you see in the literature is that it seems to be a lot more related to maybe this sort of herbal function of activating damp, sort of drying damp to some degree. Okay. What are we talking about when we talk about activating moving damp out? Is it drying the damp? I think these are probably different ways to think about it. But either way. And you also see this with even with like kidney 7. Now, we talked about it when we talked about qi stagnation of the chest, that I like kidney 7 for strengthening the lungs. In this case, strengthening the lungs' ability to push back against that liver invasion, right? But here, what you see in the literature is that kidney 7 is often used for damp conditions of the lower jiao. So bowel issues, again, the diarrhea coming up, but also a full host of urinary issues. So here again, all kinds of different urinary issues. Kidney 7 seems to be really useful for this. So enough to say it. So what you often see also with kidney 7 is that it regulates sweating. It's like kind of the kidney point when there's a sweating issue of any kind. Spontaneous sweating, any kind of sweating issues, just any issue related to sort of kidney deficiency and the regulation of the pores, then this is kidney 7. Wow, it's the metal point, so that does make sense. Okay. All right. Then you have lung 8. And then in this case, you're talking about the Harari point, right? So then the indications listed here are really pretty general. It's really strongly affecting the lungs, so breathing, asthma issues, cough, and this kind of thing. But being the Harari point, of course, or the command point, as we often say, then in that case, they say it's only the command point during its time of day on the clock, or at least during its season. So during the fall, that's what makes it the Harari point. Outside of that, it's not the Harari point. So doubly awesome if you're using it at its time in the morning when during the fall, right? So for your patients that you're seeing early, this will be very useful. But so in this case, then heat conditions of the chest, so it has that special regulation function. So, but anyways, Harari point here. So for me, this is one way to begin to think about how to use points. And so in some traditions, as I said, they're trying to overlay structure onto these points. And one way to do that is to think of them as being imbued with the same qualities that their herbal counterparts, in a sense, are being imbued with through the flavor. So this acrid, kind of spicy nature. And in this case, we're talking about sort of regulating the qi, in the case of liver 4, heart 8, and maybe regulating qi, but more in the sense of either drying dampness or activating dampness in the case of spleen 5, pericardium 5, kidney 7. And then in lung 8, it's kind of unique. It's the Harari point, so it's a different animal. But anyways, this is, in a sense, just an attempt, right, to give structure to these points. So hopefully this is helpful. We'll talk about another element another time, and we'll try to just unpack the use of these points. So hopefully these are points that if you haven't been using, that now you have some context for understanding how to use, excess conditions, damp conditions, and the like. All right, guys, cool. Take it easy, huh?